What's about to happen here is an update that will be given to the public by Dr. Masuka Fala, who is the Director General of the National Public Health Institute of Liberia, on the current situation of our fight against the coronavirus. Dr. Fala will give regular updates beginning today, tomorrow, and will continue to inform the public whenever we have new developments. So without much to ponder, I would like to ask you to switch over to Dr. Fala, who will be briefing the Liberian public on some of the measures that have been taken, some of the updates with the cases that they have been tracking and tracing, and to assure the public that the government of Liberia, particularly the Ministry of Health and the National Public Health Institute, along with our partners, we have the CDC working with us very actively, the World Health Organization, that all of us, we are working very hard to contain this virus. And we are asking for the support of the Liberian public. As you will remember, just a few hours ago, the Minister of Health was on the radio. She released, in keeping with the public health law of Liberia, she released several regulatory measures to forestall the spread of the virus. And we are also asking all of the members of the public to adhere to all of these measures because they are for the general good of the public. So we will now go to Dr. Fala.
Dr. Suka Fala will take the microphone. There he goes.
Thank you very much. Thank Honourable Minister and also want to express our greatest thanks for the leadership of His Excellency Dr. George Manowia and our Minister of Health. We come to give you where we stand now within the last 72 to 96 hours. Our index case and the close contact is positive are doing well at the 14 military hospital. We've been able to track the contacts. We have 26 of those contacts are under quarantine. 2 of those we've linked up with. One of them flew on the SM Brussels flight. We're able to use the Liberia Civil Aviation Authority to track them. One of them now is under quarantine in Israel. He's doing very well. The second one is in Minnesota and also doing well. We've been able to track the 2 of them who came on the flight based on the manifest working with the Immigration and Civil Aviation Authority. As you all will be aware, we had a second case 2 days ago of a 63-year-old female, and she's doing well now. We have her, we took her out of the population. She's now at the military hospital where she's receiving treatment. But usually in these things, the most important thing is within the first 24 to 48 hours to identify the contacts or have a knowledge of the movement of the case so that you can identify the contact and to check what is the source of the infection. As far as our investigation can tell us, we try to piece together the movement of the contact where she went to a beach party. Our last memory of an exposure of someone from Italy. She had a beach party on the 8th with some of her friends, and she said she met this friend from 30 years ago, that she had a deep embrace. And on the 12th, she became ill, left the work, and on the 15th, she went to Aspen Medical, and then also went for treatment at a clinic lab. When she wasn't improving, she came back to Aspen on the 19th with a very high fever. She was then referred to go to JFK, where she will report as a coronavirus for coronavirus testing at JFK because she self-reported and the system had been set up in place. She was kept right around the fence at the triage at JFK. She came in contact with 3 nurses who were already dressed in their PPE and face shield. Our ambulance went and picked her up and took her to the 14 military hospital where she was tested positive. We've been able to retrace the step, and we realized that she has generated lots of contact from her house. At Aspen, we have listed 36 contacts. We are going to be meeting them this afternoon. At the cleaning lab, she generated 10 contacts. And at her website, we're still trying to develop, but we know for sure there is full cooperation with us. At her website, there are 56 contacts that has been generated yet to fall, just from a single case. Also, at the beach party, thanks to A lot of those are attending the beach party and the proprietress. We've pieced together a list of about 90 persons with the phone contact for 80 of those 90 persons that were at the beach party. Since today is day 14 of that beach party, all we're trying to do now is to see those persons and ensure that they are okay from today to Wednesday. The next thing we also have done was to see whether, since from our own recollection, the only place she came in contact with someone from Europe was at this beach party. We traced the friend from Europe that we knew from our database that when she was picked up at the airport as a person of interest. We took her home. We were able to do her blood test yesterday, she and the family, and the results thankfully came out as negative. So that's one of 13 tests we ran yesterday. The whole of last night we ran 13 tests. Some of them linked up with our first case, and some of them linked with her. All the results so far has come out as negative. Today we're massively going to be taking specimens from over 50 persons that are linked with our case number 3, and to run a test. Because the best control measure is testing. Those that we think that are high risk, we continue to isolate them into places so that just in case they show symptoms, we'll be able to quickly and do the test. On Monday, we are going to be repeating the test for all of those that are now at the military hospital, and those in the close contact will be their second test. Once they come out negative, we'll be sending them home. And if our confirmed cases in the world run negative tests, after 24 hours, we'll repeat the test, and if they are negative, we'll be sending them home. So we'll keep you updated tomorrow as it goes when we test those ones in our military hospital. Thank you very much. This is the update. We continue to do aggressive contact tracing and trying to isolate all of those who are close contact. Thank you very much.
Dr. Fala, go back to Winston.
We don't want to remove this. I hope I'm audible enough. We want to use this opportunity to reiterate the call that was made by the Minister of Health, Dr. Jala, after she declared national health emergency. Dr. Jala, as the Minister of Health, in keeping with the public health law, has promulgated several regulations. And we have published the regulations that basically focuses on social distancing, on the several measures to ensure that this virus is not spread throughout the country and that we can contain it. We've just listened to Dr. Fala. This is some good news that of the contacts that were tested, those who were primary contacts and some secondary contacts, they have all proven negative. So the contact tracing is ongoing and will continue, but we are urging the public to adhere to these measures. Close the churches, the schools, the mosques, the entertainment centers, so that we can be safe. All of the measures that we have asked you to follow, please do so, because it is for the good of the public. We'll continue to harp on this message, and we'll continue to inform our people as we have additional information, because the best way to fight this virus is through the support of the community and through accurate information.
All right, we similarly will have to go back, Minister, to Dr. Fala once again.
We come as a passionate appeal to our Liberian people. In the midst of this very serious outbreak, people are bent on spreading misinformation and disinformation. This is so dangerous to the country. This one, I'm talking to one of my colleagues from Nigeria. He was telling me how the city has bigger cities. Burkina Faso, 4 of their ministers are infected, including the Minister of Foreign Affairs. Over 25 persons. It is getting very serious to imagine that Liberia will start to still spread misinformation, like the information that we are going to be spraying the country from the air last night. How can you do this to your country? In the midst of this thing, we will face a global threat. Every nation around us, including ours, will be shutting down airlines, commercial flights. Do you know what that means? We are shutting down our left now because we want to survive as a nation. And then in the midst of that, you spread misinformation. You've been too unfair to the country. Someone created a fake certificate and said signed by the UN General Secretary to declare that our initial case was free. And you have to start, because you are an extreme enemy to this state. It is not good for this country, because you bring confusion and generate distrust. Only by trust in the public we will be able to find the contacts. So please start doing this. As the Minister of Information said to you now, you will not go free if you keep on doing this to this country because you are an enemy to this state. This is our passionate appeal. We are not doing any spraying from the air. If and when we ever decide to do so, we will let the public know. It will not be secretly done. It will be done through information. Thank you very much. Our line still remain open 4455 for any inquiry you want to make. Thank you very much.
Yeah, that's the hotline 4455. Any information you have or you want to validate, you call the hotline. And the government wants to assure the citizens that we are at the forefront of this fight, but we need the support of the communities. Without the support of the communities, we cannot win this fight. Stop the misinformation, stop the rumors. Let's fight coronavirus together. Thank you.